Welcome to the deep dive.
Yeah.
Today we're really diving deep into Medicare Advantage.
Oh, yeah.
And what it all means for veterans like you.
Absolutely.
We've got tons of research here, articles, all sorts of stuff.
Yeah, the whole 9 yards.
Ready to break it all down
Absolutely.
about how these plans can work alongside your VA benefits.
Think of it like this. It's less about replacing your VA care.
Right.
It's more about adding some really powerful tools to your healthcare toolkit.
I like that. A healthcare toolkit.
As a veteran, you deserve the best possible care.
Absolutely.
And we're going to do a deep dive today to help you access it.
Okay, so first things first.
Yeah.
What exactly IS Medicare Advantage? I know it's different from original Medicare like my parents have, but
Right.
how so?
Yeah, so you're right. It's IS, different Medicare Advantage. Sometimes they call it Part C.
Okay.
It's actually run by private insurance companies. But don't worry, they're all approved by Medicare.
Oh, okay.
It's kind of like having different flavors of Medicare, each with their own perks and quirks.
Flavors of Medicare. Okay, I can get behind that.
Yeah.
But before we get into comparing all the different plans and stuff,
Right.
who is even eligible for Medicare Advantage in the first place?
Yeah. So good news, the eligibility pretty much lines up with regular Medicare.
Okay.
So if you're a veteran and you're 65 or older,
Yep.
you're in. Now, if you're under 65,
Okay.
but you have a qualifying disability like end-stage renal disease,
Right.
you're also in, of course, the standard citizenship and residency requirements apply.
So it's not just about being a veteran. You have to hit those Medicare
Right.
age or disability markers.
Exactly.
Okay, so what about veterans who have been relying on VA care for years?
Right.
Does that count towards Medicare eligibility?
But that's where it gets a little tricky.
Okay.
See, the VA doesn't count as what they call creditable coverage.
Wait, hold on. Creditable coverage?
Yeah.
What in the world does that mean?
Yeah, it sounds like a bunch of bureaucratic jargon.
Right.
Let me break it down.
Please.
Basically, if you don't sign up for Medicare when you're first eligible, and that's usually around your 65th birthday,
Mm-hmm.
and you don't have other health insurance that counts as creditable coverage,
Okay.
you might end up getting hit with some penalties later on.
Penalties like what? Extra paperwork?
Think more like a higher monthly premium for Medicare Part B
Oh, no.
for each year that you delay enrollment.
Gotcha.
It's not fun.
No.
That's why the initial enrollment period, or the IEP, if you want to sound like a pro, it's super important. That's that 7-month window around your 65th birthday.
Okay.
That's a key time to make these healthcare decisions.
So even though you've got those VA benefits,
Right.
you've still got to be on top of enrolling in Medicare on time
You got it.
to dodge those penalties.
Yeah.
This is a detail I bet a lot of veterans aren't even aware of.
You're absolutely right, but
Yeah.
hold on, there's some good news.
Okay.
Your VA drug coverage actually does count as creditable coverage
Okay.
for Medicare Part D.
Part D.
That's the one that covers prescription drugs.
So veterans who already have VA drug coverage,
Yep.
they don't need to go out and get a separate Part D plan.
That's exactly it.
Okay.
It's a little nuance that can save you money and you headaches.
Always a good thing.
Always a good thing.
Okay. Glad we cleared that up.
Yeah.
So now, shifting gears a little bit,
Yeah.
why would a veteran even choose Medicare Advantage in the first place?
Yeah.
What makes it a good addition to their VA benefits?
This is where it gets really interesting.
Okay.
See, Medicare Advantage often covers things that the VA might not,
Okay.
like dental vision and hearing.
Oh, wow.
For veterans who need those services, think regular checkups, new glasses, maybe even hearing aids.
Yeah.
It can be a total game changer.
Yeah. I can see how that would be a huge benefit, especially as we get older.
Absolutely.
It's about having a more well-rounded healthcare experience.
Exactly.
Speaking of things we appreciate as we get older,
Yes.
I'm seeing cost savings pop up here in our research a lot.
Yeah.
How does Medicare Advantage stack up against original Medicare in that department?
Great question. So a lot of Medicare Advantage plans
Okay.
use a copay system,
Okay.
meaning you pay a fixed amount for services.
Gotcha.
Original Medicare, on the other hand, often uses coinsurance,
Oh, okay.
which means you pay a percentage of the cost, which can be harder to budget for.
Okay, so with Medicare Advantage, you kind of know up front what you're going to have to pay
Exactly.
rather than getting hit with a surprise bill later.
Right.
That peace of mind would be huge for veterans living on a fixed income.
Absolutely. That predictability and the potential for lower out-of-pocket costs,
Yeah.
that's a big draw for a lot of folks.
Okay, this is where I get a little confused.
Yeah.
Can veterans use both their VA benefits and the Medicare Advantage?
Yes.
Or is it a one or the other situation?
You can absolutely use both.
Oh, okay.
In fact, that's one of the biggest perks for veterans. You're not ditching your VA care.
Right.
You're just adding another layer of coverage and choice.
Think of it like this.
You use your VA benefits for those core services,
Okay.
and then you turn to Medicare Advantage to fill in any gaps, maybe for things that the VA doesn't cover or where there might be longer wait times at the VA.
So it's all about maximizing your options and having that flexibility to
Exactly.
choose what works best for you.
You got it.
Okay, I like it. Now I'm also seeing here
Yeah.
choice of providers as a potential benefit
Yes.
of Medicare Advantage.
Yeah.
What's that all about?
Well, Medicare Advantage plans often have wider networks of providers than you might find just through the VA.
Okay.
So this means that you could have more options when it comes to seeing specialists or even just choosing a doctor that you really feel comfortable with.
Right.
Maybe somebody outside of the VA system.
I can imagine that's a big deal for veterans who may have been seeing the same doctor for years or who need a specialized type of care that's not available at the VA.
Absolutely.
So it's about having control over your own health decisions.
That's what it's all about.
Okay, so we've covered a lot of ground here.
Yeah.
We know what Medicare Advantage is,
Yeah.
who's eligible, and some of the key benefits for veterans.
Right.
But there's one piece of the puzzle we haven't talked about yet.
Yeah.
The different types of Medicare Advantage plans.
Okay.
Our sources mention HMOs, PPOs,
Yep.
and something called SNPs.
Right.
Can you give us a rundown of what each one entails?
Absolutely. So each of those plan types has its own unique features.
Okay.
And understanding those differences can really help you figure out which one might be the best fit for you.
Okay, perfect.
Yeah.
Let's start with HMOs.
Okay.
What do veterans need to know about those?
So HMO stands for Health Maintenance Organization.
Okay.
Think of it like this. You typically get lower costs, but you agree to stay within a network of providers.
Okay.
You'll need a referral from your primary care doctor to see a specialist.
Okay.
And going outside that network could mean higher costs. It's all about trade-offs.
So an HMO is a good option if you're looking for lower costs
Right.
and are okay with staying within a specific network of doctors. What if you need to see a specialist who's outside of the network? What happens then?
That's where a PPO might come in handy.
Okay.
PPO stands for Preferred Provider Organization.
Okay.
They give you a lot more flexibility to see any doctor who accepts Medicare,
Okay.
even if they're not in the plan's network.
So if you value that freedom to choose your doctors, maybe you travel a lot or have specialists you prefer,
Right.
a PPO might be a better fit. But I'm guessing that flexibility comes with a slightly higher price tag.
You got it. Again, it's all about weighing your priorities.
Okay.
Cost versus flexibility.
Gotcha.
Now, the last type we have to cover is SNPs,
Okay.
special needs plans.
Those sound pretty specific. Who are those designed for?
So SNPs are tailored for people with specific health conditions or needs. For example, let's say you served in Vietnam and now you're dealing with health issues related to Agent Orange exposure.
Right.
An SNP might be a great option for you because it can connect you with doctors and resources that are specifically equipped to handle those unique needs.
So it's like having a plan that's built around your specific healthcare situation.
You got it.
Okay. So we've got HMOs for affordability, PPOs for flexibility, SNPs for specialized care.
Right.
It sounds like there's something for everyone.
There is, but remember, this is just a high-level overview.
Okay.
Each type of plan has its own little details, and the specific benefits and costs can really vary depending on which insurance company you choose.
Right. So doing your research and comparing plans is crucial.
Absolutely.
It's not enough to just say, I want Medicare Advantage.
Right.
You got to dig deeper and figure out which flavor is right for you.
Exactly. It's like choosing a new car.
Uh-huh.
You wouldn't just pick the first one you see.
Yeah.
You'd look at the features, the mileage, the safety ratings. The same goes for choosing a Medicare Advantage plan.
That's a great analogy. With all this talk of options and benefits, it's easy to get caught up in the excitement.
Right.
But I'm sure there are some challenges and considerations that veterans need to be aware of too, right?
Oh, for sure.
I mean, nothing's ever completely straightforward
Absolutely.
when it comes to healthcare.
That's right. While Medicare Advantage does offer some fantastic potential for veterans,
Yeah.
navigating the system does come with its own set of hurdles.
Okay.
Understanding those challenges and knowing where to turn for help can really make all the difference in getting the care that you deserve.
And that's a perfect segue into the next part of our deep dive.
Yes.
We've laid the foundation here today by understanding what Medicare Advantage is and how it can benefit veterans.
Right.
But as with any journey, there are bumps along the road.
Absolutely.
In part 2, We'll explore those challenges, we'll discuss some key considerations,
Right.
and we'll highlight some of those resources
Honestly.
that can help veterans navigate this complex landscape.
Yep. So stay tuned, folks. The
Wow.
deep dive continues.
Yes, it does.
And we're here to guide you every step of the way.
Absolutely.
We'll be right back.
After a short break.
Welcome back to our deep dive into Medicare Advantage for veterans.
We've explored the basics, but now
Yeah.
let's get real about some of those bumps in the road that you mentioned.
Right.
Our sources highlighted some potential challenges for veterans thinking about Medicare Advantage.
Yeah.
Where should we start?
Let's talk about coverage. One of the biggest things to remember is that Medicare and VA benefits,
Okay.
they're not one size fits all.
Right.
They vary a lot based on your individual circumstances.
Right.
And while Medicare Advantage often comes with some extra perks like dental and vision,
Right.
you have to weigh those against potential out-of-pocket costs.
Especially if you go out of network.
Right, exactly.
That came up a few times in the research.
So it's not as simple as saying Medicare Advantage is always cheaper. You know what I mean? You
Right.
got to understand the trade-offs,
Mm-hmm.
more coverage options might mean.
Right.
You got to be more mindful of those out-of-pocket costs.
It's like that old saying, there's no such thing as a free lunch.
That's right.
You get those extra benefits, but
Yeah.
you got to be smart about how you use them.
Exactly. Now, another challenge is coordinating benefits between Medicare Advantage and the VA.
Okay.
This is where things can get tricky for veterans. You're essentially dealing with two separate systems.
Yeah, I can see how that would get confusing.
Right.
Our sources kept mentioning something about primary and secondary payers.
Yes.
Can you break that down for us?
Absolutely. So the primary payer is the insurance that covers your healthcare cost first.
Okay.
Then the secondary payer steps in to cover some or maybe all
Right.
of the remaining cost. So sometimes the VA might be your primary payer.
Right.
Sometimes it might be your Medicare Advantage plan. It really depends on the specific situation.
So if you don't understand how that coordination works, you could end up paying more than you should,
Right.
or even having gaps in your coverage.
Absolutely. That's a really crucial detail that many people overlook.
Right.
But here's the good news.
Okay, good.
You don't have to navigate this alone. Our sources mention some great organizations that can help veterans understand this process.
Okay.
Groups like the VFW and other veteran-focused agencies offer assistance and representation.
That's great.
They can help you make sense of it all and make sure you're getting the most
Yeah,
out of both your VA benefits and your Medicare Advantage plan.
that's a relief to hear. So if you're feeling overwhelmed, reach out to those veteran-specific resources.
Yeah, they've got your back.
Okay, and don't forget those licensed Medicare insurance agents
Yes.
that we talked about earlier.
Right.
They're another great resource for understanding the ins and outs of different plans
Absolutely.
and how they work with your VA benefits.
Right.
Okay, so we've got our veteran-focused organizations
Yeah.
and our Medicare insurance agents. Two great sources of support.
That's right.
What other challenges did our research uncover?
Well, enrollment and eligibility came up quite a bit.
Okay.
We touched on this earlier, but it's worth emphasizing again because missing that initial enrollment period
Right.
can really come back to bite you with higher costs down the line.
Yeah, that 7-month window around your 65th birthday is critical.
It is.
Our sources also mentioned something called special enrollment periods, or SEPs.
Yes.
What are those all about?
SNPs are like loopholes in the system.
Okay.
In a good way, of course.
Right.
They let you enroll in Medicare outside of those standard periods if you meet certain conditions.
Okay.
Like, let's say you're still covered by your employer's health plan after you turn 65,
Mm-hmm.
or maybe you become eligible for Medicare because of a disability.
Right.
In those cases, a SEP might be your ticket to enrolling without penalty.
So it's not a one-size-fits-all situation when it comes to enrollment.
No.
There are these special circumstances that can give veterans more flexibility.
Right.
But how do you even know if you qualify for a SEP?
Right.
Seems like something you could easily miss.
You're absolutely right. That's why it's so important to do your research. One resource that can really help is the TRICARE for Life Handbook.
Okay.
It's packed with valuable information about Medicare TRICARE
Yeah.
and how they work together.
Okay, so that's another resource to add to our list.
Yes.
The TRICARE for Life Handbook.
Got it.
Is there anything else veterans should be aware of when considering Medicare Advantage?
One final point I think is important.
Oh, yeah.
Remember, Medicare Advantage plans are run by those private insurance companies we talked about earlier.
Right.
And that means that the specific benefits costs
Yeah.
in provider networks
Right.
can vary from plan to plan.
So it's not enough to just say, I want Medicare Advantage.
Right.
You really have to do your research and compare different plans carefully.
You got it. It's about finding the plan that aligns best with your individual needs and preferences.
Right, just as you would with any major decision.
Exactly.
Speaking of major decisions, this whole Medicare Advantage thing can feel pretty overwhelming.
Yeah, it can be a lot.
What stands out to you from everything we've discussed?
That's a good question.
What's the one thing you want veterans to walk away remembering?
I think the biggest takeaway is that while Medicare Advantage can be a fantastic tool for veterans,
Yeah.
it's not a one-size-fits-all solution. You've really got to understand your individual needs.
Right.
Do your research and ask for help when you need it.
I totally agree. It's about taking control of your health care
Yes.
and making informed choices.
Right.
But it's also about recognizing that you don't have to go it alone.
Absolutely.
There are resources out there, people and organizations
Right.
who are ready and willing to help you navigate this landscape.
And one of those resources, if you'll allow me to indulge in a little humor, comes straight from our source material. If you don't know what to do, better call Buckaloo.
Yeah, I love it. It's a lighthearted reminder that there are experts out there.
That's right.
Who can help you sort through the complexities of Medicare Advantage and find the right plan for you.
Exactly. It's all about empowering veterans to make the best possible decisions for their health and well-being.
So we've talked about the challenges, the resources, the importance of doing your research, and even had a little chuckle along the way.
Right.
Now, in part 3 of our deep dive,
Okay.
we'll wrap things up with some final thoughts and actionable insights to guide veterans on their Medicare Advantage journey.
Stay tuned. We're about to equip you with the knowledge and confidence you need to make those informed choices.
Welcome back to the deep dive. We're in the final stretch now of our exploration into Medicare Advantage for veterans.
Yeah, we've covered a lot of ground, haven't we?
We really have, from eligibility and benefits to potential challenges and all those important resources to help veterans navigate this journey.
Right.
So as we wrap up, what stands out to you from everything we've discussed? What feels like the most beneficial or maybe the most confusing thing about Medicare Advantage?
That's a great question. It's a perfect way to reflect on everything. We've talked about how Medicare Advantage can give you more coverage options than original Medicare.
Right.
We talked about how it might even save you money with those predictable co-pays.
Right.
And how it can open up that wider network of doctors and specialists.
But there's also that added layer of complexity.
Oh, yeah.
Coordinating benefits with the VA.
Right.
Figuring out which plan type fits your needs.
Right.
HMO, PPO, SNP.
It's a lot.
It's a lot to consider.
It is a lot to take in.
Yeah.
But hopefully we've at least provided a solid framework for you to think about your options and make those decisions with confidence.
It's like we've given you the map and the compass.
That's right.
For navigating the Medicare Advantage landscape.
I like that analogy.
Now it's about using those tools to chart your own course.
Exactly. Yeah. Remember, there's no single right answer when it comes to Medicare Advantage.
Right.
It's about finding the plan that aligns with your individual needs and preferences and circumstances.
And that's where all those resources we talked about come into play. Don't be afraid to tap into those veteran-focused organizations, licensed Medicare insurance agents, even the TRICARE for Life handbook. They're all there to guide you and answer your questions.
They're like your Medicare Advantage Sherpas. They're there to help you climb that mountain of information and reach the summit of informed decision-making.
That's a fantastic analogy.
Yeah.
And speaking of helpful resources, we can't forget that memorable slogan from our source material.
Oh, yes.
If you don't know what to do,
better call
Buckaloo.
Buckaloo, that's right. It's catchy, isn't it?
It is.
It really does underscore the point that you don't have to figure this out alone.
Right.
There are experts who are ready and willing to help you navigate the ins and outs of Medicare Advantage.
So as we wrap up this deep dive, what's the one piece of advice you want to leave our listeners with?
Okay.
What's the most important thing for them to remember?
If I can leave you with just one thing, it's that Medicare Advantage has incredible potential to enhance the healthcare options available to veterans. It's not about replacing the VA.
Right.
It's about understanding how those two systems can work together.
Right.
To give you the best possible care.
I couldn't have said it better myself. It's about empowering you to take control of your health and well-being and make those informed choices that lead to a healthier and more fulfilling life.
That's what it's all about.
Well said. Thank you for joining us on this deep dive into Medicare Advantage for veterans.
Yes.
We hope you found it informative and empowering.
Absolutely.
Until next time, take care of yourselves.
And stay curious.